Hello, everyone. I'm Thomas Mendez, and today I'm going to be talking about public health in my country, Venezuela. So, firstly, I want to analyze how structural wealth disparities and severe economic inflation dictate physical well being. So, nationally, we see a profound health crisis in Venezuela. Hyperinflation and economic stagnation have severely compromised the public healthcare infrastructure, creating a massive disparity where lower income populations suffer from a resurgence of preventable infectious diseases and lack access to basic maternal care. Globally, this reality mirrors wider disparities across the global south, where vulnerable nations they basically face structural barriers to obtaining basic medical supplies, transforming survival from a human right into an issue of geographic privilege. So, when examining the root causes, we must look past simple biology and focus on the social determinants of health equity outlined by the World Health Organization. In Venezuela, unfortunately, the loss of purchasing power means families cannot actually afford basic nutrition, safe housing, or even clean water. So, if we apply the intersectional lens, these identity layers compound drastically, and a low-income pregnant woman, for example, a low-income pregnant woman living in a rural interior state faces overlapping vulnerabilities. She deals with the severe transport shortages, which is horrible, by the way, high food insecurity, and localized medical deserts, making her risk in profile infinitely higher than an individual with financial assets in a major city center. This is the reality right now. Now, these social inequities lead directly to catastrophic health outcomes. So, because public hospitals lacks basic materials such as antibiotics, surgical gloves, or reliable electricity, patients are forced a lot, like to pay entirely out of pocket for their own supplies. Wealthier individuals can rely on private clinics or international remittances to secure treatment, whereas the marginalized majority are left with severe, delayed, or completely unavailable care. Globally, this dynamic illustrates how historical economic instability and modern financial crisis isolate specific regions, basically locking vulnerable communities into generational health penalties. Now, how can we mitigate all of this? So, in order to do that, these profound gaps, um, firstly, we need to look at the evidence-based solutions from similar crises. First, we should integrate social determinants into the training of local community health workers, so that allows for a decentralized network capable of distributing emergency nutritional and medical resources straight to marginalized households. Second, as underscored by global equity research, investing in climate resilient, community managed solar water purification systems can directly eliminate waterborne disease outbreaks in rural areas. Also, it can bypass damaged national infrastructure without putting an extra financial burden on vulnerable families. So that's it. Thanks so much for watching.